Good afternoon, everybody. I'm Wendy Dyer, and I'm delighted to be here with all of you and my friend and colleague, Kate Dana. We want to thank our sponsors. We're very grateful to them for being so forward-thinking and offering up these webinars at no cost to you. So just by way of quick introduction about our work, we are currently managing over $100 million in projects, both in campaigns and annual funding. So we are painfully aware of the situation that we're all facing in the nonprofit sector. And we look forward to having this discussion with you today. And our goal is to not lecture or proselytize in any way, but our goal is to have you maybe think of things a little bit differently, approach things a little bit different, build what Kate will describe more deeply about scenario planning into your daily habits. And our hope is that if you leave these webinars with the tools to build a new approach, look at things in a different way, then we hope that you will find that they were worth your time. Right, Kate?
Right. Hi, everybody. I'm Kate Dana. Thank you so much for joining us today. As Wendy said, we've been helping a lot of organizations navigate the challenges of COVID and all that's come with it. We've put together this webinar series to bring some of the ideas that we've found really helpful for other organizations to you who are all working so hard during this time. And we're starting with scenarios because developing the scenarios for what the future might hold for our organizations will give us a sense of what we need to fundraise for. So we hope you'll find it helpful and informative, and let's get started. Wendy's gonna kick us off.
All right, so today, again, we're gonna introduce you to this concept of scenario planning, and we hope that you will embrace it and encourage you to add scenario planning as you continue to modify your financial contingency plans, which we imagine most of you got down into that very deeply in March when the pandemic really struck and we saw what the future could hold. Also, we hope that you will recognize the broader implications of the current crisis for your organization and think through that. And as Kate said, how does that then impact your fundraising? And understand how you really can adapt whether things settle down or whether things implode, or one may say continue to implode. So to set the stage for some thoughtful discussion, there is an incredible amount of advice and information circulating around here. People talking about best case, medium case, worst case scenarios. But what we want to challenge you first with is, why is our first response when something isn't perfect that we always want to cut back and be reactive? That seems to be always our first response. Why can't our first response to be proactive? Maybe even take advantage of some of the opportunities that are out there. Maybe this trifecta, which is the pandemic, the economic response, and then the civil unrest all on top of that, maybe this trifecta creates some opportunities we haven't thought of that your scenario planning could unveil to you. And nonprofits, you guys are already proving your ability to pivot and to recalibrate. It's really quite remarkable. And together, maybe we can use this collective anguish for good. Maybe it's a chance for a do-over in some of our programming. And who knows best about your programming and what your clients need than people like you in the trenches working every day to satisfy needs firsthand. You have seen for decades the inequities that people are facing. Perhaps the best thing that the pandemic has brought into the world's attention is all this inequity on every single platform: health, race, income, education. It's now been brought into the glaring light. We don't believe that that's going to go away anytime soon. And in fact, Kate and I believe that inequities are going to be the focus that will impact our fundraising for the next several years. And that's actually a very good thing. So does this provide us an opportunity to reimagine ourselves into something better than we were before this started? Is it our time to get together as nonprofits and make real change and not just operate in these silos? So Kate's going to talk to us more about scenario planning.
So the scenario planning we're talking about today is a little bit different from the financial contingency planning that many of you have probably already done. We'll talk a little bit about some best practices in that area too, or things to make sure you've done. But what we mean by scenario planning today is really how to think about the future and see your organization in it when you can't really anticipate exactly what's coming. Our discussion's in part modeled by a really great article that was put out by the Monitor Institute by Deloitte, and we'll look at the scenarios that they developed. I think it's a pretty helpful resource. You'll find it at the end on the resources page, so we've included it. But scenario planning in this regard is really a tool for challenging the status quo and a way of envisioning your organization in different futures to think about how you might respond, because that will let you know what actions you can do now to prepare. It's also a way for seeing what opportunities could open up for you and what possibilities might be brought. Even though it seems like a time of real difficulty, there could be opportunities to do things differently. What we really want to encourage is adapting scenario thinking for your organization and considering how you can use it to create flexible plans for the future and provoke new ideas. So this goes kind of beyond revenue, because events unfolding here are going beyond our ability to raise funds. So the scenario thinking process involves 5 steps, and you move through them distinctly, but they all kind of inform one another as well. We'll cover each of these in a little bit more detail in the subsequent slides, but here's a high level. So first, you want to get oriented, right? You want to stabilize your organization, have your contingency plan for your financials, and then really think about your mission, vision, values. Where are you? What would you prioritize? You also want to evaluate the landscape and get input from other people, other perspectives. What do the people in your kind of area see as opportunities or coming challenges? You want to consider the knowns and unknowns. The goal is to synthesize all of this into a framework, and we'll show you how that works graphically, of scenarios that you can see your future in and kind of reimagine what you might be doing as an organization if those scenarios occur. And then you want to keep an eye on which way the wind is blowing and whether it's pushing you in one direction or another towards those scenarios that you've laid out. So going back for a moment, though, to financial contingency planning, can we advance that one slide, Wendy? Let's talk about this for a minute. So this is the budgetary process that many of you have already done. If you haven't, it's really important to do that at this point, to look at your best, medium, and worst case scenarios financially, and considering both your revenue and your expenses, think about how your organization could be impacted and what you might do about it. If you haven't developed these budgets, it's definitely something you want to do now. Be sure to look at both your revenue and expense side. Right now, we're all worried about where the revenue might come, but many of you are probably already seeing that your expenses are changing. In many cases, going up. You may be replacing volunteers with paid labor. You may be having to incur costs for personal protective equipment, and things can be getting more expensive even though you feel like you're delivering less programming. On the revenue side, I know a lot of you are struggling with galas and what to do about that, so you want to think that through as well. This is a very good thing to do quarterly, but also be thinking 12 to 18 months ahead, continuously thinking what we're going to do. And you want to know what you'll prioritize in each of these circumstances. One of the things that Wendy and I found really remarkable in doing some research recently was how there is a real risk of fraud or loss of revenue to fraud in nonprofits. It was very eye-opening that 13% of revenue, according to an article by the Chronicle of Philanthropy, is lost to fraud. That doesn't apply to every organization, of course, but it applies to some. And if you don't have good financial policies and procedures in place, now may be the time to do that, to really clean up your house, have those accountability methods, good practices for dual check signing, tracking funds, reconciliation. And of course, this is a good time to think about having a reserve fund, which is something we always talk about in times of hardship, but sometimes doesn't necessarily materialize once things come forward a little bit.
Yeah, if I could just add, Kate, we're not suggesting that any of these organizations have fraud that's happening in broad daylight or under anyone's eyes, but the reality that, and this was a study by the Chronicle, as Kate indicated, that if indeed 13% of our revenue is lost to fraud, that is something we all really, which again was astonishing to us. And we only use the best resources for these webinar series. And we believe the Chronicle Philanthropy is, of course, sets the gold standard for it. So if they found that 13% of revenue in general, on average, is lost to nonprofits, what a fantastic way to figure it out and cut your costs rather than cutting your staff, and et cetera, et cetera.
It's a great point. So the next part of scenario planning, or really the start of scenario planning outside of the budgetary area, is thinking about your mission, vision, and values. So in developing scenarios, these are good things to look at first. And think about, does anything need to be recrafted? Or if you had to change what you're doing, what would you focus on? You might see some areas that are easier to focus on now than they were at other times, or vice versa. You might create a list of what types of possibilities you will consider or not consider. I think it's particularly important to identify, since it can be hard to decide, what you're not going to be thinking about. Like, we're not going to worry about costs, we're going to worry about coming up with great ideas and then see how we can finance them. Or what you will focus on. If you can't do your programming, maybe it's time to think about what could we do to really target the root problem. There can end up being a good list of these criteria. Wendy, could you advance to the next slide?
You know, and one moment, just one sec, real quick, Kate.
Sure, sorry.
I love this slide and this concept of what we focus on and what we won't focus on. And again, our next webinar on development planning, it's really critical. We think about all the things that we're doing, but the question that we should always ask ourselves, what can I stop doing right now? What am I doing right now that's just not impacting mission, vision, values, or in fundraising, it's not impacting the bottom line of bringing in revenue. So I think that's an overlooked concept of what can we stop doing. And that's what, in this next slide, Kate's going to take us through, this elimination matrix can help you think through.
Yeah, that's a really important point. And the elimination matrix is just a little tool, and you'll get this in your handouts, for outlining what you will and what you won't focus on. So we've given you a template. And this is an organization that runs a health clinic in St. Louis. They're a nonprofit, of course, and they're trying to decide how to adjust or focus their programming under certain scenarios that they've developed that could play out in the future. And so in this left column, they list what they have decided they will focus on, because sometimes there's a lot of factors that come into play. So sort of a set of rules based on their values, based on their board discussions, based on their conversations with their executive staff about what's possible, kind of a set of rules or guidelines to help narrow and vet the options that come up. Because a lot of times we have tons of ideas and we aren't sure which ones to prioritize or how to prioritize them. This, using an elimination matrix, kind of a nice snapshot emerges of which ideas are aligned with your priorities.
And you can use this for absolutely anything in your organization. It really applies to all of your critical thinking.
Yeah, it's great for any decision making where you want to try to have a streamlined or value guided process. So in addition to looking at your organization internally in scenario planning, it's really important to look at the landscape, obviously, outside of the organization. And unlike strategic planning, scenario planning really works from the outside in. The entire focus of scenario planning is what's going on out in the world. What are the factors that are likely to affect our organization, our ability to do our work, where we should focus. So you first consider the broad external landscape, including social, economic, technological, political trends. And then the context of your organization's own working environment, like who might you be able to collaborate with? What is particular about the people that you serve, and what does that mean in a different scenario or a different future? Who are you connected to, who you might be able to engage? Then you consider all of what this means for your organization and the scenarios that you develop.
So speaking of what's going on and what's influencing you, so what are some facts that we know about? What's happening and what's going to happen over the next 12 to 18 months? It's not any surprise to anybody that we're already having economic consequences. We're going to have more economic consequences. That's just kind of a no-brainer. Candid did a study that talked about nonprofits and those that typically close. By the way, in general, every year, 4% of all nonprofits will close. But what Candid identified over a multi-scenario figure is that they anticipate another 7% would be joining those ranks of closing, for a total of 11% nonprofits potentially closing over the next 12 to 18 months. I believe in the most dire scenario, and we'll look at a quadrant in a little bit that shows minimal impact to maximum impact. Candid identified that up to 38% of nonprofits would close, and don't let that freak you out, because of course that's a terrifying number. But point being, we all need to start thinking in scenario planning and financial planning and tweaking our development planning, et cetera, to try to avoid that worst case scenario. Unemployment is expected to be kind of stuck. The last thing I saw from a great source was that we could almost be facing some type of unemployment even over the next decade or so. And that's, of course, an enormous bummer and just painful, painful, painful. Of course, we've seen this influx of funding from the government with the Paycheck Protection Program, whatnot, but we also know with the lack of taxes being collected in state and local governments, we're going to see a serious loss of tax revenue. Of course, that's got major implications for all the important things that the nonprofit sector exclusively deals with, like education, like food access, like social services. I just want to take a moment to pause and applaud all of you for impacting people in these categories, because were it not for the nonprofit sector, who would be providing these? But anyway, we are bracing for impact there. What else we know is that individual giving, which happens to be in major gifts, my favorite thing to do, it's really sad. It's actually been declining before the 2017 tax reform. We know that people are still very, very generous. We know, but relative to income, the middle income people are more generous than higher income people, even though higher income people give larger amounts of money relative to their income. The middle class is more generous. That's a problem if our middle class continues to erode, of course. But we have to remember that there's still extraordinary wealth. And it was astonishing to see that since the pandemic started, where we're having all this economic impact, there are more billionaires created. So money begets money, and don't ever lose track of that, because the more money builds, and that's why we're seeing this big gap between the income levels.
So, and that leads into the assumptions. Deloitte, as part of their study that I talked about earlier, identified what they thought were 5 prudent assumptions for this time, and they align to with what Wendy just said. First is, I think we can expect the pandemic to intersect with and compound other trends. We're already seeing this. So. Digitization, more people than ever are online, right? Here we are online. Racial health, education, the level of unrest over the summer, all compounded by the pandemic. So it's really pushing some of these things to the forefront. The need for our services are invariably going to be greater than the resources. That has always been the case, but a crisis like this pushes that gap. And so a lot of organizations are going to face really difficult choices about who to serve and where to focus. As Wendy mentioned, some NPOs are going to have to close or consolidate. So thinking about those things now and what could happen in the future is something that scenario planning really helps you do. If it comes to that, or if it's going in that direction, or you see your primary sources of revenue possibly being under threat, maybe consolidation is something to consider. So, or who are the partners to be talking to now? So scenario planning is really empowering in this way. Communities of color are very likely to be hardest hit, and along with other marginalized groups, they are already hardest hit. And the pandemic data shows very much the same. They're more likely to be economically vulnerable. And if you are an organization that works with and represents those communities, that's something to really be thinking about how to get ahead of. The national spotlight on these issues, I think, could help you from a funding perspective. And we are already seeing that the effects of the pandemic really vary across geography and time. So while one place is opening up, another place is shutting down, and we may have that type of fluctuation going for quite a while into the future.
Right.
So another part of scenario planning is really questioning what our assumptions are and avoiding sort of delusional thinking or hoping for things to go back to normal. As organizations, we always have assumptions that we're operating with. We make assumptions about how much we can raise. We make assumptions about whether we can raise it, and what it will cost to do certain things, about what our staff roles and responsibilities are, about how our donors will behave. And this type of situation can throw a lot of that into questions, and it's worth reevaluating those things. At the same time, we want to avoid sticking our head into the sand and hunkering down and saying we'll be okay if we can just weather this, because as Wendy mentioned, it's likely that organizations will close, some of them. So thinking ahead about how to get your services out and stay operational and relevant and command the funds you need is a great thing to be doing now before you have to face those futures.
If I could just add, delusional thinking isn't always a bad thing. A lot of in our fundraising, we have to believe we can reach our goals. Because if we go forward with poverty thinking or can't happen or won't happen, that's what we're going to project to our donors. And we'll get into that with the third webinar about authentic donor communication. But I just want to point that out. It's just so central that we can do this, we will do this, because that's what's going to affect the people that we need to come into our circle and support our next phase of our organization as we're weathering this. Right, Kate?
Well, and that's a great point. And I wouldn't actually put that under delusional thinking. I would put that under assumptions, you know?
Okay.
Because I think we do have this scarcity thinking at times where we assume that there won't be enough, or we can't do it, or it's too steep of a climb, or no one will ever fund that. This is a time that's going to generate creative solutions, and I think that's going to create creative revenue sources and new opportunities with funders.
And that's what we need to move forward thinking.
Agree, absolutely.
What you think is what you get. Okay, I'm going back to Sunday school there. All right, here we go.
So one of the things to remember as we think about the landscape is that historically things have tended to build slowly and happen in big leaps, what seem like leaps, but they've been coming along for decades often. And you can look at many examples in history from this, everything from the New Deal to LGBTQ rights. The speed with which that evolved surprised a lot of people. Title IX for women, there's been a lot of movement for women for decades, and that was like one of the biggest equality acts passed. So there's a lot that's coming to the surface now that's been building for decades, and looking around at the landscape to see what those things are for you is something that will really help as you configure scenarios for your future.
Right, so as Kate said, we feel like, well, what just happened here? That this seems so sudden, I don't know what to do, but it's totally not. This has been burbling, all of these things that we see. What are we doing about our aging population? That's huge. What the nonprofit sector is going to step up, of course. What are we doing about affordable housing, healthcare inequity, education? All of these things are not brand new. The coronavirus being a novel virus, as they say, that may be new, but all these problems that it's potentially devastating, impacting, we've been dealing with for decades. Those of you in the nonprofit sector have known it, you felt it for decades. This is perhaps our time again to work together to help donors and others really understand the impact of all of this and therefore make real good collective and systemic change. Right,
Yeah,
Kate?
now could really be our hour. Is I think what we're both, have talked about, that you see racial inequity coming to the forefront and people in the streets about it, and parents really realizing, all of us, what inadequate childcare options mean, so these things have been talked about for a long time, but this could be a time where real action happens.
That's what we're hoping here, yeah.
Yeah. So in developing scenarios to think about, to do scenario planning and think about the future and decide what it is that you want to work around, you want to identify a couple of things that you're most concerned about impacting your organization or your ability to do your work, and consider how they'll play out. That's the basic outline of scenario planning. So what are those critical what ifs for your organization? The Deloitte article that I mentioned looked at two factors. They looked at how severe the economic and health crisis will be, and these are linked because even though they're not the same crisis, they are definitely tracking or connected in that the virus is causing significant unemployment, and that hasn't crashed the markets yet. I mean, there was that blip in March, but it is having a big impact economically one way or the other. And then also they looked at how cohesive or willing society is to work together. And let's look at these a little more detail in the next couple slides. So on the first factor, the severity of the health and economic crisis, we can imagine that this would be kind of two ends to the spectrum. On one end, it could be really severe, where we can't get the virus under control, continue to have these hot spots erupting, or the second wave, they say, or the third wave. It could continue to really devastate the economy by mandating things shut down, people can't get back to work, and inequality of all kinds sort of keep coming to the surface as people get more and more restless and frustrated with this situation. On the other end of the spectrum, this could be resolved relatively painlessly. I mean, it's been pretty painful so far, but if a vaccine is developed pretty shortly, we could move into an era where this is sort of a new stability or a new normal, and can go forward. Now, each of those ends of the spectrum would bring certain challenges for us. If things get terrible, it could make it hard for us to operate, but it could also open a great opportunity in that everyone is starting to think this situation is not working, we need to change how we're doing things. But if things normalize really quickly, we may have missed an opportunity. The social end of the spectrum also has the same things. If we cannot pull together and work together as a society, government's still not going to be able to effectuate policy. We're going to have gridlock. On the other hand, if more and more people appear to be on the same page, and the current kind of trend of people seeming to get it continues, we could have widespread demand for change that could lead to really good things for the work we all do.
Right. So this is really cool. So here's a 4-quadrant thing, and this is a real life example of a medical provider and how they did their scenario planning and what changes they could expect in each of the 4 quadrants, meaning, as Kate was describing, return to normal, or maybe it gets a little worse, or top right, rising from the ashes, things are looking pretty bad, or this whole severe one. So let's look at each of this. And again, this is a real life example. In this case, things return to normal pretty quickly in their situation. But it wasn't as if everything that they did went back to just regular business as usual, because the need to increase your communication with donors, when this pandemic hit, that's what we heard: talk to your donors, talk to your donors, talk to your donors. Again, we'll talk about that in subsequent webinars. It's not that easy to do if you already don't have good communication with your donors. But in this case, this nonprofit did increase their communication with donors, and it totally paid off. They raised more money, they developed better relationships with the funders opened doors to other possibilities. But the other thing is, because their delivery model, service model, couldn't be performed as they normally did, they didn't just close up shop, because the need was still there. So it forced a launch into a new service delivery model, which resulted in them being more regional and nationwide. So let's move forward, and as they're planning, and this is again on the axis, lower impact of crisis here, but everybody's getting along up here. So let's move back here. Still, things are getting kind of normal, but low social cooperation. Nobody's getting along. Everything is really divided. So what does this nonprofit want to do if this becomes reality? They recognize that funders are going to start thinking about pulling back that direct services and maybe directing money to a different type of nonprofit, a 501c4, for example, that might find some more systemic solutions. That would impact definitely a direct service provider. But the need goes on, so they can't exactly not find funding, so they've got to find ways to appeal to other funders. So they also begin advocating the need for public health funding to reform the healthcare system. So if this happens again, we don't get in the same scenario that we're in. They also thought, we're stronger together. Let's build deeper coalitions. Let's get a unified voice to really promote this need for direct services. There is no better or more obvious basic need than direct services. They may think about launching a mid-level donor campaign, not just relying on the donors at the top, but reaching down to those mid-level donors. So here's their second quadrant. Now let's move up to the top right. So here we have everybody's getting along, the nation's not divided, communities are all happy, but the crisis is getting pretty darn bad. So there's financial scarcity, donations are down. What are we going to do? Well, this organization decided, well, if that happens, I'm going to band together to really take this opportunity. As Kate and I have been trying to say, there are silver linings with these crises. Don't waste a crisis is what they say. Maybe I can band together and create real social change. Remember, this works here in this quadrant because everybody's getting along. That does not work down here when we have low social cooperation. So might we rise to the occasion where people are getting along, if they are, in this scenario planning quadrant, to make policy makers and funders, make them receptive collectively to what's happening. Because finances are scarce, I gotta maybe staff, I don't have as much staff in this organization at this point, so maybe I have to mobilize more volunteers. Unfortunately, maybe we have to furlough or cut some staffs. Maybe we get rid of the non-essential programming, which goes back to what the elimination matrix was very helpful for. What can we now stop doing? I might also think about renegotiating our vendor contracts, or maybe not a 30-day payout. Maybe I can negotiate a 60, 90-day payout. So here's their scenario plan in the event they're in this quadrant. Now here's the ultimate. We got a high impact of the crisis. Things are just tanking and nobody's getting along. Nobody's cooperating. So that's pretty darn Armageddon, right, Kate? Yeah, dire.
Right. Yeah, this is
spelled differently than my name, I might add. But here's what the plan is here. Because the public health services are falling, because there's no more taxes being collected, the organization is now, the irony, more relied upon than ever. So isn't that, again, and I applaud all the people in nonprofit who can sustain this kind of stuff. Funding goes down, need goes up. Isn't that kind of a cruel irony? But here's what's happening in their planning here. The cost of delivering their services has gone up 2 to 3 times, but those same dollars that they functioned with when they were up here in the top left quadrant are only serving 1/3 of the people. So the question for scenario planning is, what does this organization do in this situation? Maybe we have to establish some type of triage system so everyone gets served, but maybe not immediately. Maybe we have we serve the most in desperate need first. Maybe we go back and work tighter with our top level of donors. But what's important is that the donors who don't carry out the programs like you do, they have to understand the impact that this kind of high impact of crisis and low social cooperation is making directly on the people that you serve. And that's incumbent upon nonprofit organizations to be able to communicate that effectively. So it would be very important to do that. Maybe you have to tap into reserves. I know most of you hold on to those reserves just like they're pure gold, and I get that. You might have to dip into there. Maybe that's what they're for. And then, of course, as we've been talking about, is it time in this worst case scenario for a possible merger so that at least the people in need are still being served?
So in developing the scenarios for your organization, you can work through those scenarios, those different factors. The level of economic and health crisis will probably likely be one for anyone, but also consider the factors that really you think are most likely to affect you. So you want to develop those. And so what do you do with those once you have them and you sort of have decided what the factors are that you are most concerned about? Couple things. You want to consider what will signal, as we mentioned, it's part of the monitoring, what will signal that we're going in that direction, because you're trying to be as proactive as possible. I mean, that's what scenario planning lets you do. So you don't want to react. You want to keep an eye on the trends that seem to be pushing us in that direction. And you can think about what opportunities would that open. We often think about what will happen on the negative side, as we've said, but are there opportunities that this opens that maybe weren't there before? Or are there incremental changes that need to be made, or a moonshot? There could be something big, bold, and fabulous that you're ready to take on and you could get a funder really excited about doing. You want to think, what challenges does this present? What we can do now to bring about or prevent the scenario, what the staffing would look like, what your programming would look like, who you might partner with, and how you can really use your resources, your people resources, your brain trust, your board, your groups of supporters to really help you figure out what might navigate those scenarios.
And Kate, to that point, might this be a time to really use the real talents on the board? So many of our boards are looked upon for fundraising and attending events and things, but they're all there because they've been successful in their life. So right. What better people to tap into when you're struggling? Bring them in and they have them help you approach these things in what could be a very, very different way. So could be a great time to really use and engage with your board around, meaningful programmatic stuff.
Yeah, I think that's so true. And this is such, your board, they also have a lot of different perspectives. And we're often looking for things for our board to focus on and move forward with. And scenario planning is something that ideally, I think, should be incorporated almost quarterly into board culture. The situations will not always be this dire, but but that's what a board is really for too, in part, right? I mean, to help you navigate the future, and they all have good ideas on how to do that. And this is a really useful skill for them to engage in.
Right, and something that could be very meaningful and memorable to them. So give them something really meaningful to do. I love that.
Talk about a really rewarding board experience.
Exactly. So next steps, everybody loves change, right? Change is inevitable.
I like change.
Change is inevitable. Adaptation is a must. As the entertainer Josephine Baker said, when you no longer have anything new to do or say, she said, you have to constantly reinvent yourself, because when you no longer have anything new to do or say, you disappear. So might this be our opportunity to adapt and think like Josephine Baker and reinvent ourselves into something different? It's an exciting time to test the possibilities, aligning with thought leaders, group together to make systemic change. Where there's uncertainty, there's also opportunity. And in closing here, close to closing, scenario thinking can help you emerge better and stronger. Kate?
Yeah, well, we've really enjoyed sharing this information with you, and we hope you'll be able to join us for the roundtables next week that are going to come after. You'll get an email about how to register for them. Space is limited. They're on next Thursday at 9, 11, and 1. There will be a little homework, so bring that. And we super appreciate you being here and all the fabulous work you're doing in the community, and for having us help you with that work. And we're very grateful to our sponsors, the Jewish Federation, Missouri Foundation for Health, and United Way, who also do so much good work and have brought this.
So Brian's going to take us through some Q&As. Also on here, we do have our contact information. Kate and I are resources for you. If we didn't cover something, feel free to reach out to us. We'd be happy to oblige. And also in your packet, you will find Kate referenced several times the sources that we use for this webinar. Thank you.
Thank you so much. Good luck. Bye.